Hey everyone, thank you so much for joining me today. My name is Dr. Chris Boman. I'm a pediatric and family chiropractor that sees lots and lots of special needs families, special needs kids and adults, and everywhere in between. What we're really going to focus in on today, what you signed up for, is to figure out how the perfect storm or how anxiety and ADHD and other sensory concerns develop in kids. Because that's the major question, right? Nobody knows what causes autism. Nobody knows what causes these things. Or even though experts say that they don't know the cause of autism or ADHD or things like that, and largely it is hard to figure out what is the one thing that caused the trigger. We can actually put together a pretty decent history that will give us an idea of the accumulation of stress. And those are the things that typically are leading up to anxiety, ADHD, autism, and the other spectrum disorders. To put it in a way that we might understand a little bit better as adults, let's say you were lifting and you hurt your back a little bit, didn't do anything about it, tripped and fell, didn't do anything about it, and then one day you bend down to tie your shoe and your back goes out completely. Like you're down to your knees, you can't walk. Hopefully you've never had that experience before, but if you have, you know exactly what I'm talking about. Was it bending down to tie your shoe that actually caused your back to go out? I hope you're shaking your head saying no at home, because obviously you've bent down to tie your shoe millions of times throughout your life. What we're looking at is most likely the buildup of stress in your muscles and in your nervous system from that trip and fall, from that weightlifting accident, from sitting all day. There's a whole bunch of different things that can contribute to stress within your nervous system and within your muscles that hold up your back, leading to a point where your body has no more room for adaptability. It can't push itself any further. So literally doing one little tiny thing is all it needs to set it off. And I'm sure some of you have had that experience where you had a happy, healthy kid and one experience caused regression, or we were developing well up to this point and then we stopped or plateaued or started going backwards. Or maybe we started developing really quickly and then we started to pull back. Maybe that's your story. And what I want to do is just kind of shed light on the things that might have been developing that maybe your pediatrician or OBGYN never told you about or never had you look at. And we're going to start to put the dots, put the puzzle pieces together, connect the dots, so that way we can now figure out what to do about the problem of anxiety, ADHD, aka the perfect storm. So we've already talked about a little bit. The perfect storm is an accumulation of major stressors in babies, kids, and teens that gives us results in a neurological stress or an overload of what we call the sympathetic dominance in their systems. Okay, so in your autonomic nervous system, let me backtrack. In your nervous system, that's the communication control center. Okay, let me show you what it looks like on the spine. We have a spine here. We have the spinal cord, which is inside all these vertebrae, and you have these yellow things, which are nerves that are going to every body part. Okay, when you receive information from the environment that touches the sensory receptor, everything we're touching, tasting, feeling, smelling, all that stuff, the information is going to go through the nerves and to the communication highway in the spinal cord. The spinal cord is going to take it up to the brain, and at that point, the brain is going to process it and decide, here's what I should do with that information. It'll send that information back down through your spinal cord and out your nerves, and at that point, you are adapting to your environment. However, if your spine stops moving the way it's supposed to, it can lead to a sympathetic or a fight or flight response to put your body in that state of survival. When your body's in a state of survival, it lowers and lowers and lowers your ability to adapt until you get to a point where your body can no longer adapt to the outside environment. And the symptoms result of either, lots of speaking to no speaking. You didn't react to this food and now you react to this food. You were meeting milestones and you're not meeting milestones anymore. The perfect storm accumulated to the point where it got so big, it delayed and interfered with the neurodevelopmental system. So what we want to do now is kind of connect the dots. When we come into the office here, we do a pretty in-depth history of your child. Anything from checking about fertility. A lot of times if we do in vitro or other sources of fertility treatments, that can be a stress on the embryo right away. Or other pregnancy challenges such as medications that you had to take during your pregnancy, high emotional stress or physical stress during your pregnancy. And then when the time came for labor and delivery, maybe it was a really intense labor, from really, really fast where the kid just slipped out to really, really long, to a cesarean section, to a forceps delivery or a vacuum delivery. All that can cause physical trauma to the baby right at the beginning of life. And if the baby is stressed right from the beginning and the stress wasn't taken away, that's going to lead to the accumulation of stress, like we talked about earlier. When these kids grow up, they start to develop colic. And as they still grow up, they start to continue that stress pattern, which eventually trickles into the digestive system, which trickles into the immune system, and which I'll go over, the kind of like timeline in a second, which eventually can lead to sensory and spectrum stuck child. Another example or analogy that I like to use is when your skin is not sunburned, you can touch, rub, whatever, and it doesn't bug you, right? However, if you get a little sunburn, it becomes a little bit more annoying. The more sunburn you get, the more annoying it gets to touch, right? It's the same thing in our kids. If our kids are born with a little bit of a sunburn, and the things that we're doing, such as antibiotics, other pharmaceuticals, not breastfeeding, or having an emotional stress going on at home, these continue to worsen the sunburn of the baby's nervous system, which increases the amount of stress, which limits the amount of stimulus that the baby can actually take. Let's see what that looks like from a symptom perspective, because maybe you're like, well, how do I know if my baby was born, neurologically sunburned? In infants, the type of symptoms that I see of stressed babies are reflux, colic, torticollis, which is when your head gets stuck, it can't turn one way or the other, digestive issues such as constipation or gassiness, and generally just uncomfortable babies that aren't sleeping, that aren't happy, that aren't content. As the infants start to get older, physical stress such as like tension, they don't want to move their arms or the legs, or delayed in milestones such as crawling or rolling over. Once again, torticollis, we start to develop now plagiocephaly, which is when they can't turn their head, they start to develop a flat spot, which I do a whole seminar on torticollis and plagiocephaly if that's something that your kid struggles with, so you can look for that one. And then now we're developing constipation. How that affects other areas of the baby is we look at the immune system, maybe more vulnerable to things like RSV or other common but not normal baby illnesses, chronic congestion, chronic colds, and ear infections. And then as the baby continues to get older, when we're at those key stages of development, sometimes these kiddos are fast achievers, where they crawl, or they're rolling over at 6 weeks, they're crawling over at a couple months, they're running or walking, or walking and running at 7 to 8 months old. We should have a timeline of development. When these kids are speeding through their developmental milestones, they're really not developing the neurological pathways that are needed to continue that development to higher level, more complex movements or interactions with the environment. If we just basically touch along the way, it's kind of like you have a full tank of gas and you stop at the gas station when you're empty, you only give it a gallon, and then you keep going, you only give it a gallon. You're always falling behind, because even though you're getting more forward, you're always falling behind in how far you could be, because we're not giving the time to fully recharge, to fully develop those neurodevelopmental pathways, which looks like as these toddlers get older, more immune challenges, more ear infections. Now we're developing sleep issues and other digestive issues. And when we get even older, in that 4 to 6 year range, we're looking at sleeping problems, attention problems, hyperactivity, go type of personality, because this baby is stuck in a state of stress. So in my opinion, when we're looking at the development of ADHD, autism, ADD, anxiety, depression, all these kind of spectrum disorders, if you look at the timeline of the development of your kid, was there a stressful pregnancy? Was there a stressful delivery? Was there stress early on? Was there stress through development? Was there a continual amount of stress pouring through your kid that over time caused the nervous system to become more and more sunburned and less adaptable, therefore more sensitive to whether it's pharmaceuticals, whether it's more sensitive to foods or more sensitive to sensory information around them? And so instead of looking at these behaviors as why are you doing this now, what I want you to look at is let's continue to go back in time and see, when did these things start to develop? Because when these kids start to get to 8 to 10 years old, that's when we're looking at anxiety, that's when we're looking at more sleep issues, more behavioral issues. And 12 to 15 year olds, that's when we're developing more emotional issues such as anxiety or depression. Hormones start to go whack, behavioral issues start to come about, and then eventually you're getting into the 15 to 17 year range where you have super high low, or super low lows, super high highs, depression, motivation issues, low energy, and then maybe even a couple more years developing autoimmune issues. See, the stress, the more it snowballs, the more systems it starts to affect, and the more complicated the systems get, making it more difficult to isolate what caused this problem. So when we're looking at these symptoms of ADHD, anxiety, autism, and any other spectrum disorder, instead of looking at what exactly caused this exact symptom, what we want to do is go down the list of when these type of symptoms might have started to develop, when the nervous system started to get more irritated. And then now we know what to do. Instead of putting out the fires one by one, symptom by symptom, we can look at what can we do to calm down that nervous system. If you remember in the beginning when I showed you the nervous system is protected by the spine, right? We talked about the spine's not moving right, that causes stress to the brain. And so if we get the spine moving the way it's supposed to, that's going to de-stress the brain, improving your body's ability to adapt. When we talked about stress in the spine could have started from the day you were born, if you're born especially cesarean section, forceps, or vacuum delivery. But even a uncomplicated vaginal birth can still cause stress right at the base of the neck. So it's possible stress in babies started from the moment that they're born. So if we're speaking from a preventative aspect, if you know anybody that's pregnant, definitely get them in to see a pediatric and prenatal chiropractor. If you know somebody that has a newborn, definitely recommend getting them into a pediatric and prenatal chiropractor, because we can look for stress before it starts to become symptomatic, before it's reflux, before it's colic, before it's ear infections, before it's depression and anxiety and the whole perfect storm. And that's the goal. But also, if you're anywhere along that continuum, at any time, it's a good idea to de-stress the nervous system. And so that's what we really focus on in our office, is reducing the stress within the nervous system. And you might ask, well, I know how you can feel for movement, but how do you know the nervous system is actually stressed? And that's a great question, because in the office, we actually focus our whole first and second visit on, one, the history. So we look for all these sources of stress. And two, we test your spine. We do infrared thermography, which measures inflammation from your low back all the way to the base of your neck, so we can see if any area in your spine is inflamed, causing the nervous system to be stressed. The second thing that we look for is high muscle tone. We look for muscle spasming. When your spine isn't moving right, it's because the muscles are on lockdown. The muscles are on lockdown because the brain is stressed. And so that's never gonna go away. It's a constant loop of more stress, more tension, more inflammation, more stress. And so you can see how that loop just continues to cause more and more issues, right? And so when we're able to figure out where the stress is and how bad it is, I can create a care plan, which lets me know where to adjust, how many times to adjust, and for what length of period we're gonna adjust for. And then we also are able to test along the way, so we know that when we get to the end of the care plan, our nervous system is not sunburned, it's highly adaptable, and the perfect storm is able to unravel itself. And then we can start talking about nutrition. We can start talking about PT or OT or speech therapy, because the body is ready to accept those extra stresses, because we put the aloe vera on the inflamed system and it's able to calm down and start to take in more information. And so I hope this was super helpful for you. I hope this brought light to what we can do besides just medication, or what we can do besides just putting out the fires or the every other symptom, and get to the root cause of why these perfect storm kiddos develop, and what we can do from a holistic and root cause approach. I highly encourage you to schedule a consultation if this resonated with you, if you're local here to Murrieta. My number is 951-698-4848. You can call or text, and I'd be happy to help you and see if I can help you and your kid get rid of that burden of emotional stress for the parents, thinking, are they doing something wrong? Of the physical stress for the kids, being stressed and in pain potentially, and give that kid a long highway of optimized health and well-being, so they can continue to develop and be who they were created to be, whether it's an engineer or a doctor, maybe a chiropractor one day, and cut that dependence on the medical system of being constantly needing medications or being told, this is what you are, this is your label, this is what you have, and being free from that and being able to develop and be a kid and be a teenager and enjoy friendship and enjoy relationships and enjoy doing things that they might not be able to do right now. If you know anybody that struggles with these issues, please share this with them, because I know it's going to make an impact. Thank you so much for sticking with me. Hope you enjoyed it. We'll see you soon.